Good afternoon, everyone, and thank you for joining this session. Today, we'll be discussing COVID-19, myth busting, and other helpful information. My name is Dr. Nathan Delafield. I am coming to you representing Valleywise Health and District Medical Group today, and I look forward to interacting with you all. Hopefully, this is a helpful, interactive session. Um, this presentation will be recorded. If you do have to leave to another presentation, know that the content will be available for your review in the future. So we'll start with fundamental information. What is COVID-19? COVID-19 is the virus, the disease that is caused by the virus SARS-CoV-2, pictured here. It is, as we all have learned over the course of the last year, spread through respiratory droplets. Those are heavy droplets that can spread between individuals less than 6 feet apart from one another. And it can also live on hard surfaces for up to 3 days. What are the symptoms of COVID-19? Highly variable. Some people have no symptoms at all. Others experience fever, cough, sore throat, diarrhea, some of the more common side effects. Other symptoms include body aches, runny nose, fatigue. Other patients will develop shortness of breath and chest pain. It is important to know that symptoms may develop as long as 14 days after following contact with the virus. How do I prevent against getting this terrible virus? Well, mask up. And we've demonstrated over and over again that that's an effective way. 2 masks are better than 1. We have found that well-fitting masks are really important to lowering the spread of this virus, particularly with the more infectious variants that are out there. Routine hand hygiene with soap and water, or at least 70% alcohol in a hand sanitizer. And of course, physical distancing, which has certainly been probably the most difficult for us all. And as we have found more recently, get vaccinated. Vaccines are highly effective in reducing the spread of COVID-19 and reducing severe illness. We'll talk more about the specifics of the viruses shortly. It's important to note that this virus and this disease has disproportionately impacted Black and Brown communities. I'll point you to Black or African American non-Hispanic persons experiencing hospitalization on an order of 3 times Caucasian individuals, death from the virus 2 times the rate of Caucasian individuals. Similar data is available for Hispanic or Latino persons, which we've been seeing a lot of here in Phoenix in particular. Other communities that are disproportionately impacted are our Native American communities, particularly here in Arizona. We've seen on the reservation that our Native American communities have been hospitalized and are dying at higher rates, which is truly a terrible result. Now, how do you get tested for COVID-19? There's a variety of ways that we can test now. The most common is a nose swab. It is a little uncomfortable, but it should not be painful. There are throat swabs that can be done. The Arizona State University has developed a saliva test. And these tests generally are what are called PCR tests. These are highly reliable, accurate tests with very little false negative and false positive results. But there are other types of tests also. These are rapid tests. Those rapid tests are also known as antigen tests. And these tests are associated with false negatives and false positives that may lead to an inappropriate sense of security. Now, there are blood tests also called antibody tests to show if you have had recent or remote exposure to the virus, but these generally can't tell you whether or not you're actively sick or contagious from the virus. Again, to note rapid testing, it's good, but it's not perfect. And we've seen the good but not perfect type of testing strategy, unfortunately, throughout all of this last year, as we've learned more and more about COVID. I would just impress upon you all that if you have developed symptoms that are concerning for COVID, despite a negative COVID test, particularly a rapid test, you may still be infected with the virus and you may still be contagious. So quarantining and seeking advice from medical professionals is recommended. Now, what is close contact with COVID-19? Well, it's specifically defined by if you spent more than 15 minutes within 6 feet of someone with COVID-19 and you weren't wearing a mask, and eye protection. Eye protection is also very important. You provided care, close contact with someone who was sick with COVID-19, again, without those additional precautions. You hugged or kissed them, you were drinking or using utensils from them, or you were within 6 feet of a sneeze, cough, and you're not protected with those respiratory droplets on you. Now, what to do if you've had that close contact? The most important thing to prevent the spread of this virus is to quarantine, to prevent additional people from getting sick. And the current CDC guidelines suggest that you should quarantine for 7 days if you receive a negative test after your exposure, and 10 days if you decide for some reason not to get tested. You should monitor for symptoms throughout that period of time, and you should also do your due diligence to inform anyone that you've had contact with after that exposure that you are being tested for COVID so that they too can get tested and protect themselves and their family members. Now, how do I need to get tested? I think generally, anytime a patient is asking me that question, the answer is yes. If you are at all concerned, get tested, contact your doctor or local health professional, visit Arizona Department of Health Services to find out where you might be able to get tested, or your doctor might be able to arrange testing through their healthcare organization. Now, if unfortunately you have tested positive, what do you do? It's going to be quarantine, call, monitor, and seek. Quarantine, quarantine, quarantine until you have spoken with a healthcare professional and they give you advice on when you might be able to lift that quarantine. You'll want to call your local healthcare professional and or doctor to set up a telehealth visit through COVID-19. Most healthcare organizations are offering virtual visits so that you aren't exposing others to the virus. You want to monitor yourself. If you've developed shortness of breath, chest pain, dizziness, or confusion, those would be worrisome signs and symptoms that would warrant you to seek out emergency help, either calling 911 or going directly to your nearest emergency department. So I'll quickly move through this. I just want you to know that there are a variety of treatment options. Most patients will recover from coronavirus without incident and will not require hospitalizations. Some of the treatments that we commonly recommend are just rest, hydration, Tylenol, or ibuprofen for some of those bothersome symptoms. However, there are a subset of patients that are eligible for monoclonal antibodies. These are essentially antibodies that have been created in a lab that can be given to you so that we can fight back the virus that you've been infected with. Now, there's very specific eligibility criteria with each one of these treatments. And so you would want to seek out advice from your physician and or other medical provider to see if you are eligible. What we know about these treatments that are infusion therapies, usually given in emergency departments, is that they do reduce the risk of severe illness that requires hospitalization. So for instance, in individuals who are 55 and older with chronic lung conditions, diabetes, obesity, chronic kidney disease, you would be eligible for these infusions. And anyone over the age of 65 would be eligible for these infusions. Now, it's also important to know these infusions are really only given to people who have recently tested positive or recently developed symptoms highly consistent with coronavirus. So if you had the disease and it's been 3 weeks, most facilities would not give you the treatment because in those patients, patients don't seem to improve from them. Now, there are lots of treatment options if you do end up in the hospital, and I'll move through them quickly, but suffice it to say, we've learned a lot in the last 1 year about this virus. When this all started, we didn't have any effective treatments. Of course, we can give you oxygen therapy by nasal cannula, ventilators if that's necessary. We know by laying you on your belly, we can improve the way that your body receives oxygen, particularly for sick patients. We very commonly and routinely give people steroids if they are in the hospital requiring oxygen. The next most common therapy is called remdesivir, which is an antiviral therapy, given up to 5 days and can improve outcomes in patients. Now, the next 3 items are more experimental treatments and they have not demonstrated significant improvement in outcomes. but you may hear about them and can be given if no other options exist or if patients get really sick. And then finally, we continue to give patients Tylenol or ibuprofen for fever and body aches. Some patients recover quickly and others take a while. Now, how long do I quarantine? For mild or moderate symptoms, meaning that you don't require oxygen, supplemental oxygen, and you haven't required hospitalization. Generally, we recommend 10 days from when your symptoms first started. And you also have to experience an improvement in your symptoms and be fever-free before we lift that quarantine. Now, if you have severe symptoms, meaning you require hospitalization and oxygen, we do recommend 20 days from when your symptoms first started, plus an improvement in symptoms, and you have to be fever-free before we lift that quarantine. I'm happy to say that here in Arizona, COVID-19 is on the decline. You can see that Christmas Day was just before the biggest, greatest peak that we've seen in Arizona, which ultimately resulted in over 12,000 cases in one single day. Currently, we're averaging less than 2,000 cases per day, and over the weekend, we even had less than 1,000, which is really encouraging. We have rolled out a vaccination phased protocol that has been tremendous and has contributed in part to why we are so successful in dampening the spread of the coronavirus in our communities. We're currently in phase 1B. And so individuals who are 65 years and older, living in congregate care facilities, 75 years or older, working in healthcare, law enforcement, and teachers, which are other essential workers here in Arizona, are all eligible for vaccination. Soon, hopefully, we'll be seeing individuals who have high-risk medical conditions become eligible. Now, I really wanted to spend a little bit of time on talking about who is getting vaccinated. It's important to note that we vaccinated well over 1 million individuals in Arizona, at least with one dose. Over 500,000 have received both doses, which on average is about less than 20% of the community or the community that have received at least one vaccine in Arizona. The disproportionate individuals who have received this vaccine are white, followed by other race unknown individuals. A significant disproportionate and disparaged group are Black or African American individuals. So we make up 1.5% of the individuals who are currently being vaccinated, most of which are our elderly. However, it's important that we get these numbers up to protect our communities. I'll quickly move through how the vaccines work. We have 3 emergency use approval vaccines as of now: Pfizer, Moderna, and the Johnson & Johnson vaccine, which was just approved over the last 1 week. Pfizer and Moderna vaccines are what are called mRNA vaccines. These vaccines have some of the genetic material for the SARS-CoV-2 virus, specifically the spike protein. The spike protein are these little red dots that you see in the right upper hand corner of the presentation. These proteins allow the virus to attach to our cells and get us sick. And so the blueprint, the genetic blueprint, the mRNA for that spike protein is what is included in those 2 vaccines, Pfizer and Moderna. Essentially, when they are injected into our body, the mRNA tells the immune system, if you ever see this spike protein again, like Dikembe Mutombo would say, I want you to produce T cells, B cells, and antibodies to attack it. How does the Johnson & Johnson vaccine work? It's really new. And is it effective? Well, how it works is this virus is called the adenovirus. This is a virus that has existed for a long time, and what we've done through engineering and technology is we've incorporated the DNA of the coronavirus spike protein into it, and we have allowed the adenovirus be a vector or a transportation material. Now, the adenovirus is killed in a lab, and so it can't get you sick, but it does effectively allow that DNA to enter into the body and produce spike proteins. Now, once those spike proteins are produced, again, the body recognizes them, produces T cells and B cells and antibodies to fight off the virus. What we know about the Johnson & Johnson vaccine is this technology using the adenovirus vector is very old. We've been using it and looking at it since the 1970s. It's a fantastic way to vaccinate. Patients have, or we've demonstrated over the years that it's a safe way to vaccinate. It's only one shot compared to the others, which are two vaccines. And is it effective? Yes. After 28 days, it's 100% effective in preventing hospitalization. After 28 days, 67% effective in preventing symptomatic illness, 85% effective in reducing severe illness, and 74% actually effective in preventing asymptomatic transmission. So it's really, really a wonderful vaccine to consider. There's a lot of talk about virus variants. They're coming from the United Kingdom, South Africa mostly. There's also California, New York variant. The variant viruses change, and that's the common course of infections that are viruses. And that's the natural course. We expect that. And these two variants in particular make them about 30% more contagious. And what we do know currently is that the available vaccines are effective, perhaps less potent, but are effective in reducing transmissibility of these infections, death, etc. These variants also haven't been demonstrated to increase risk of death overall, but there is more research to be done to determine whether or not in the future we will all need more vaccinations to boost our immunity. How do you get registered? I'll be honest, it's kind of complicated. Yesterday, or day before yesterday, I spent about 30 minutes on the phone trying to get a patient of mine registered because as a lower class Black man living in South Phoenix, Levine, he told me only rich people get vaccinated. And I was heartbroken to hear that he felt that way. But it was my experience that it is very difficult. And so this is some of the reason why it's important that we are advocates for our patients and that we are creating streamlined approaches to getting these patients vaccinated, these people vaccinated. So you can do three things. You can go to podvaccine.azdhs.org. That's going to be your three major distribution sites, such as State Farm Arena. You can also visit the following website, the maricopa.gov website, to find all of the vaccine locations, including Walgreens and other federally qualified health centers that are now distributing the vaccine. At my clinic and throughout my organization at ValleyWise, we've just been given approval to start administering the vaccine. So that should happen in the next couple of weeks and improve the administration of vaccines to Black and brown people. And then finally, as is common for my patients, if you don't have technology, you don't have a computer, you don't know how to do that, call 211 and be persistent, and you can get registered for the vaccines. So we'll move on to a few myths that I've heard, and then I'd like to open it up to the audience to discuss any myths that you have. If you don't have any, I've prepared many others that I have heard as well. So the first myth is COVID is just a bad flu. It's not that bad. The fact is that COVID-19 as a disease is 5 times more deadly than the seasonal flu, and that is just becoming more and more obvious as time goes on. Another myth, COVID vaccine will give me COVID. This is probably the most common thing that I hear about just about any vaccine. But when I have looked at the way that these vaccines have been developed, they have been done so in a very, very, very advanced fashion to ensure that patients are not getting COVID-19, the disease, from the actual vaccine. So it's important to know that the 3 available vaccinations that are on the market, Johnson & Johnson, Moderna, and Pfizer, cannot give you the virus. What is possible is that if you are insufficiently vaccinated or you have encountered the virus before completing your series, you can still get COVID. And they aren't 100% protective against getting the disease. We know that they're very effective, but you could still get sick despite being fully vaccinated. So it's important to maintain all of the other health measures that you have to avoid getting sick. What are the common side effects of the COVID-19 vaccine? Common side effects are injection site pain. That's something that I experienced after both my first and the second vaccine for Pfizer. Fatigue, you may experience headaches, muscle aches, and possibly even a low-grade fever. Now, it's important to note that these side effects are generally very short-lived and fairly mild. Um, uh, Severe side effects resulting from COVID-19 vaccination are extremely rare, on the order of about 5 per 2.8 million vaccinations given. In individuals who have developed those severe side effects, we know that those individuals generally have developed severe reactions to other vaccines in the past. It's also important to know that when you experience these side effects from the vaccine, the response of your body developing those T cells, those B cells, and those antibodies. So actually, it's demonstrating efficacy. One other myth that I've heard: after I've been vaccinated, I no longer need to wear a mask. Well, I'd like to say that was true, but 7 to 14 days after your second vaccine, you are 95% protected, depending on which vaccine you've received. Um, uh, now that's from getting sick. We are learning more and more about the virus, and the vaccines, and we are finding that there is reduced asymptomatic transmission as well. And so you may not only prevent getting severely sick, but you may prevent actually coming in contact with the virus, it entering your body, such that you could asymptomatically spread it to others. Um, and so more is to come on exactly how effective it is on the asymptomatic transmission, but the data is very promising. And so even after vaccination, with very few exceptions, it's important to maintain all of the hand hygiene, physical distancing, and wearing a mask, though the CDC and Dr. Fauci have come out recently suggesting that the risk is quite low in spreading the virus between two mutually fully vaccinated individuals after the allotted time period. And so if it was a small gathering with trusted individuals who are doing the right things outside of that engagement, and they've also been vaccinated, the risk of transmission between those individuals at this time seems likely minimal. Another myth: I can't get sick after I've been vaccinated. Again, it's not 100% effective. You can still get sick, protect yourself and your family, but it is highly effective. I've already had COVID. I don't need to wear a mask, get vaccinated, or physically distance. Again, that's false. You can get COVID-19 again. We've been at this for over about a year now. And so we don't know how long natural immunity lasts after you've had the infection. Maybe 6 months, 3 months, 9 months, various things have been thrown out. Each individual is also different, but we do recommend that individuals that have had COVID-19 get vaccinated after they have recovered from their virus and they've lifted their quarantine. Um, this is a concern from some individuals that because of the newness of COVID-19 vaccines, particularly the Pfizer and the Moderna, that it might alter your DNA. That's not true. Actually, the mRNA vaccine can't interact with your DNA or your genetic makeup, and it just teaches your body how to respond. Actually, the mRNA is covered in 2 layers of what are called lipid bilayers or fatty bilayers, and they degrade really quickly. So they exit your body really quickly after teaching your body how to produce those spike proteins. Another very common myth that I have heard is that I can't get the COVID-19 vaccine because I have medical conditions, including but not limited to diabetes, kidney disease, heart disease, lung disease, pregnancy, or I'm on medications that suppress my immune system. I would always advise that you consult your physician. However, there really aren't any patients in particular that are contraindicated to getting the vaccine, except for those patients that have had severe allergic reactions to vaccines, much like the mRNA vaccine in the past. So if you had your first vaccine and you had anaphylaxis and stopped breathing, then we generally would say you probably shouldn't get another dose. However, if you've felt unwell after a vaccine, that was probably just your immune system ramping up. And so that is not a contraindication. Women who are pregnant weren't studied in the initial trials, but the American College of Obstetrics and Gynecology, which is the governing board over OBGYNs, do recommend that patients get vaccinated. But this decision is an individual one, and I recommend that you consult your physician. So at this time, I would like to open it up to hear about some of the myths that you have heard, and perhaps we can have an interactive discussion. If there are no myths, I will again share my screen and we can carry on with other myths that I have heard.
We do have one question so far. And the first question is, I'm assuming that this is vaccines from the government is a statement. Vaccines from the government are dangerous, especially for Black people.
Oh, very good, question. I do not believe so. Um, Now, it is really important to know and to acknowledge that in the past, science has failed Black and Brown communities. We are aware of that. As a Black physician, I have these discussions with patients regularly. Um, Going back to the Tuskegee experiment and Henrietta Lacks, we have had so many examples as to where healthcare has failed us and where government systems have failed us as well. However, in looking at the way that this vaccine has been developed in 2020, 2021, I believe that not only is this a safe vaccine, it is a safe vaccine for all people, Black, Brown, Asian, and I believe that there was no misleading factors in their development. Now, commonly my patients will say, well, it was developed too quickly. My response to that is it was developed quickly because we are facing the worst worldwide pandemic that we've ever seen. It's killing Black and Brown people at disproportionate rates, but the technology is actually not new. We've been looking at this technology for the treatment of cancers for a number of years, over 10 years now. And so we've just, with an accelerated motivation because of how deadly this virus is, we've developed it, having the smartest people all around the world looking at one problem. And so we were able to do that successfully. So no, it is not dangerous for Black and Brown people. It is encouraged that we take care of one another and our community members because you're dying at higher rates. It's a literal problem and matter of life and death.
Yes. And you did answer the second question I see here, that the vaccine was made and tried too fast.
Yeah. So there were shortcuts that were taken very strategically to allow for the vaccine to become available for administration, but it went through all phases of clinical trials. It was demonstrated to not only be safe, but highly effective. The shortcuts that were taken were done so in a way that would accelerate production. And so what we are now in the process of doing is evaluating on a continuous basis individuals now, over probably 10 million individuals have been vaccinated, and evaluating side effects, evaluating outcomes and efficacy. Everything that we do and have seen on a continuous basis has been incredibly reassuring. And so I do not believe that it was made too fast. It was made with a sense of urgency because people are dying and we can't allow for this to continue.
All right. Thank you, Dr. Delafield. We appreciate all you're doing. Thank you for your service. Up next, we do have one of the board members of PhilPCO who's going to close us out.
Um, Dr. Delafield, first of all, thank you very much. Um, very well said and very well done. I just sent you a little note. I wondered if you should speak to some encouragement about those who may be thinking about or aspire to be on the front line in the role such as you.
Yeah.
We know that there are shortages out there, and they are getting worse, not better. And in as much as we keep trying about, well, I want to see somebody that looks like me, you and others, I might add, throughout this fair, I'm proud to say, represent, in addition to your specialty, but I wanted people to see that, one, they are there, and that two, they need more. So I was just hoping that you could close with encouraging the people who are listening, and maybe even encouraging them to encourage their sons, daughters, or whatever to aspire to these roles.
Yeah, thank you, Ernie. Black men in medicine represent less than 3% of physicians in the United States. That stat has not changed significantly since the 1960s. And so
Yeah.
there are huge disparities that exist in representation. We know that patients of color experience outcomes, whether it be cancer outcomes or maternity death outcomes related to childbirth, at disproportionate rates compared to others. And part of it is due to systemic racism that has perpetuated healthcare over decades. And so having representation, being an individual in the room that can advocate for patients is key. And so we are doing everything in our power to encourage young people to put themselves in a position to change that narrative and to be individuals in the community that help rather than hinder these outcomes, changing how our patients are seen, how they are treated, and the access to care that they are provided. And so I believe that we all need to do our part in encouraging young people, finding ways where we can be impactful in their lives, and being mentors and sponsors of them so that they can be successful. And of course, if anyone who's watching this presentation or anyone who's currently on the presentation is seeking an individual who can demonstrate that path, look no further than me. I'm happy to be a pillar in our community and help your loved ones get to the point where they too can represent our communities.
All right. Wonderful. Well, again, for FIBCO, for those who attended the session, for the community, I want to say thank you for joining us today. Thank you for sharing. And I want to say to those of us in the audience with me that this presentation, as well as all the others in the fair, starting tomorrow, will be available on this site. If you want to go back and replay and look some more at the slides that Dr. Delafield presented, you're able to do that. The other thing is to ask you to feel free to give us the feedback. You should have or will soon receive a form that, it's just general feedback, how did it go, what did you think, how might we do better in the future? And if you complete that and send it in, it will help me as chair of the board and the rest of the organization to make presentations like this even better and to better develop our programs. And of course, we always love your donations since we are not for profit, but things do cost. Thank you. Have a good day. Thanks again, Dr. Delphi.